Hi, this is Monica Estes with Innovative Endodontics. I am putting together a question series for people exploring a new dental opportunity at an endodontic practice and the questions that I think that you should be posing before making a decision of which practice you join. There's so much that I've learned since residency that I wish I had known back then. And so I'm hoping to shed a little bit of light on the things that I have learned and hopefully might be useful to you as well. So the first question I want to tackle today is compensation, because that is what everybody worries about the most. That is of utmost concern when deciding where to go, and it also can be a little bit confusing. So in compensation, there's a few different things to consider. I remember as a resident, all we talked about was how much are you getting paid? What percentage? 40%, 45%? Is it on collections or production? So that is all the buzz of what everybody talks about. But that number can be a little bit misleading. So of course there's production, or if the practice participates in insurance, it would be adjusted production, because of course you're only going to make money off of the production that the practice makes. And if they participate with insurance, it would be adjusted. And those adjustments can vary. So you do want to understand which insurance programs does a practice participate with, what is the average percent of write-off for procedures. All of that factors into how much you're going to get paid. If you get paid on collections, then you need to really understand what is the practice collection rate. Is it nice and strong, 98% or higher, or potentially not? So those are very, very important questions that you need to ask, because 45% might sound wonderful, but if the practice has poor collections or participates with a lot of really poor insurance programs, you might not be making as much as you would hope. The other thing to consider when we're talking about a percentage is to know a percentage of what type of schedule. So if your schedule is going to be full, that's great. But what if you're joining a practice where there maybe isn't enough to support multiple doctors and your schedule might be light? So meaning maybe the owner doctor is going to get, nice slammed, beautiful schedule every day, but you might get some leftovers. But you get offered 45% and another practice, say, offers 40%. Well, 40% of a nice full schedule is much more money than 45% of a half-filled schedule. So the topic of compensation is not just a percentage or a number, which is what we thought back in residency. It is much more complicated than that, and you should certainly have a mentor, somebody who can guide you through asking that question. In addition to percentages of collections or production, you also want to consider, are there any bonus structures in place? Are you getting a sign-on bonus? Is there a relocation stipend or allowance? Also things like CE, or paying for your malpractice insurance, or paying for your membership to the AAE. So there are lots of great ways that you can be incentivized as a doctor for a new practice. So I hope this has been helpful, because I do think that sometimes people think of compensation and they aren't really getting all the details, and they're just looking at a number on the surface, but there's so much more to it. So if you want to talk more about that or have additional questions, I am happy to help. You can reach me at monica@innoendo.com. And I look forward to speaking with you more. Thanks so much.